Why do you think we spend so much time trying to keep people as functional as possible? Why is that important?
Because it keeps them with a little bit more independence. They still have a little bit more dignity that they can do it themselves, even with cueing, than somebody dressing them.
So keeping people maximally functional, figuring out ways to do that probably decreases agitation and has a benefit for them as well. They get pleasure from it or rewarded from it or feel like they're more independent.
You know, they don't want to rely on you to do everything. When they come in, they want to be independent, you know, as they were before they got here.
And how about with dressing? When you first notice that somebody's either not getting dressed or putting their socks in their hands, what are some of the things that you try, even at the beginning of that problem, to help people be independent with getting dressed?
I would verbally cue them by, for example, if it's to put a shirt on, I would tell them, you know, I need you to put this over your head and open up the actual hole for where their head goes. Then once that's done, you got to put in your left arm and then open up the hole for their left arm so they can stick their arm through, and so on and so forth like that.
So it does
I
help
forget,
for some
yeah.
people to talk them through the activity.
Yeah.
Can people ever be helped by sort of showing them how to do it? Like if you imitate brushing their teeth,
Yeah.
then they can do it?
Yes.
Sometimes.
Sometimes they'll go to eat but won't remember to use utensils. But once you show them to use the fork to pick up the food, then it's almost like it comes back to them. They remember how to do it, even though they may have had trouble to begin with. So once you kind of initiate it and show them what it is they need to do, they can usually do it by themselves.
That might be a general principle in helping people be more functional, is if sometimes they can imitate you. They may not understand what you say, but if you show them how to brush their teeth or use a fork or spoon, then they can do it.
You need lots of patience because it takes them longer. It takes you 20 minutes sometimes with a resident. If you do for them, you can get in and out. But in AL, to keep them mobile and to keep their ability, you know, and their dignity, you have to have patience.
That seems one of the
That's it.
keys to keeping people functional, is being patient. And
Right.
you mentioned that before. We're kind of adapting to their speed and their style of doing something.
I think it's a matter of getting to know your residents. Again, I have one resident that likes to have ketchup on all of her food. Now, she doesn't talk, and you wouldn't be able to necessarily figure that out by asking her, but yet if you go to give her a bite and it has ketchup on it, she'll open her mouth right away. If you go to give her a bite and it doesn't have ketchup on it, she's not going to open her mouth. It's just something that you learn.
Since the goal is to keep people as functional as possible, if you can find some trick or something that they like that gets them to do it, even if it seems unusual to us, the point is they're feeding themselves or using the toilet or getting dressed. And that's really our focus, not so much exactly what they're wearing or exactly what they put on their food.
Yeah.